Today, we're delighted to welcome Clarice Flemming. Clarice is Health Plan Coordinator for Caribou Wealth and focuses on helping clients understand their options for health insurance. She's going to cover Marketplace plans, which are made available through the Affordable Care Act. Clarice and her team at Caribou Wealth are some of our core partners in providing non-commissioned health insurance counsel. For clients who want to work with Caribou, please reach out to us directly. With that, Clarice, take it away.
Good afternoon and welcome. Today we're going to be going over Marketplace 101, your guide to navigating ACA health plans. So essentially, Marketplace, some people call it the exchanges, Affordable Care Act health plans. I've even heard it referred to as Obamacare. So a lot of different names, but it's where you can purchase healthcare for an individual or family on the Marketplace. My name is Clarice. I'm thrilled to be here. I'm a health planning coordinator over at Caribou, but really I'm an education enthusiast. I love the opportunity to spend some time with you and focus on your priorities for healthcare optimization. What that means is getting you the maximum amount of coverage for the least financial exposure or risk and the least cost, and optimizing your healthcare so you can optimize your well-being. So I'm thrilled to join my colleagues here over at Retirement Planning Services and go through these options with you. What we're going to cover, we're going to look at why healthcare planning is so important, marketplace basics. I want everyone to have a good understanding of how it works, what the foundation of this healthcare is, so that you can pick your optimal coverage. And I'll walk you through how to pick that coverage, and then your next steps for open enrollment. So, why is healthcare planning important? Why should I spend 5 minutes of my day on something so boring? Well, I'll tell you, a majority of adults aged 25 or up listed healthcare as their top fear in retirement. This sort of graph here shows you the total, but it also breaks down by generation between millennials, Gen Xers, and baby boomers, and said how many of them agreed or strongly agreed with the statement that healthcare was their top fear in retirement. And it's overwhelming, a staggering number that a lot of people worry about it. They don't know how they're going to pay for this. We have a case study that looks at a client who was retiring and going out to look for healthcare. They were losing their employer plan that they've been on for the 30 or 40 years of their career. They didn't know where to turn. So they did a Google search and they found a broker. And this very nice, wonderful person talked to them about all their options, and they picked a Blue Cross Blue Shield EPO plan. It was a great plan. And this client came to us and she was very happy. She loved her plan. It had been working great. It was perfect for her. She was paying $2,500 a month. That exact same plan was sold on the open marketplace for $1,700 a month. The difference was that she was paying commissions, broker fees, and added charges. It was a huge, significant drop, and she could have enrolled in 5 minutes on the exchanges direct herself without the need of any broker. So I'm not saying anything against brokers. They do a wonderful service. They really do handhold you and help you find coverage if you are confused or lost. But be aware that you are paying for that service, that there's a cost involved. So there's a lot of options for coverage. You could have COBRA. So when you leave your employer plan, you can enroll in a COBRA to extend that coverage a little longer, but it's usually pretty expensive. You could enroll in your spouse's plan. Maybe your spouse is still working and they have coverage through their employer. You could go private off the marketplace, like the client did, where she bought through a broker, Blue Cross Blue Shield. You could look for pre-retiree benefits. So maybe you're with a union or a group that has retiree programs, like a federal employee health benefit, a teachers union, the Screen Actor Guild Award. I've seen pilots as well, Delta and United pilots. So you might have benefits through a retiree program. But we're going to talk about the marketplace. This is available to absolutely everyone. It can range from very, very cheap to kind of expensive. So there's a plethora of options depending on your budget. And again, it's available to everyone. Consumers who went on healthcare.gov, they actually compared plans, selected a plan that fit their healthcare and financial needs, paid on average 38% less per month than the consumer whose plans were auto-renewed. So when you sign up for the marketplace for the first time, they're going to ask you, do you want us to cancel your plan and email you and telling you that you must enroll in new coverage every year in open enrollment? So you have to take action. Or would you like to set up your plan to auto-renew? It'll just tick over you don't have to think about it. Well, a lot of customers choose the auto renew. It's very simple and easy to do. However, it's also very simple and easy to get super complacent, not pay any attention, and secretly your health insurance is raising your premiums year after year after year. They're charging you more and more and more and more money, and you're not paying any attention, and you could end up paying 38% more than you need to. So, let's give you guys a background on Marketplace. How does the Marketplace work and run so that you can make these choices and save yourself potentially 38% or more? The Marketplace is an online superstore. Think about any kind of online store. When you go to like Amazon and you want to buy, I don't know, a digital camera, you can pick different digital cameras and compare them side by side. In fact, Amazon will often show you, if you scroll down, it'll show you, look at other cameras, who has the longer battery life, who has a bigger zoom, who has such and such. The Marketplace does exactly that. It's magical. You can see Cigna against United, against Blue Cross Blue Shield, against Humana, and you could see side by side who is giving me more coverage for cheaper, who has better services. So they are all ACA compliant. I'm going to tell you what that means in a minute. And it's a one-stop shop. You look for your health plan, you pick it, you add it to your cart, you proceed to check out, and it is a little shopping trolley on the right-hand corner, just like anything else. You proceed to check out. They're going to say, hey, is this confirming this is the healthcare you wanted? You're going to put in your name and details, and you're going to check out. It's so simple. So there are federal and state-based websites. The federal website is healthcare.gov, and all of the pale blue states are those. And then the dark blue or black states are states that say, you know what, we don't want to use the boring old government site. We want to make our own. We want to be Covered California, or Get Health, or Penny, which is the acronym for Pennsylvania, or Get Covered New York. So there's a lot of different states that have carved out here. These are the links to all of the different states that have coverage. I mentioned Penny in New York and California, but the two new ones this year are Georgia Access and My Arkansas Insurance. So you may be in Georgia and maybe you've always used healthcare.gov. This year, new platform. It's going to be entirely different for you. And I'll scroll down so you can see the full effect of all of the different states that have carved out plans there. I keep mentioning ACA, Affordable Care Act. It was a law, was signed into law to create the Marketplace. So it was created in 2010, the Affordable Care Act, and they wanted to increase healthcare accessibility. So who has access to this? Affordability, who can pay for this? It's so expensive. And patient protections. We want to protect our patient and make responsible changes that, for the better, impact healthcare across the country. So let's talk about accessibility first. Who is eligible to buy healthcare on the Marketplace? Everyone. Everyone. You can get a plan based on your age, your sex or gender, your smoking status. That's it. I'm a woman. I am this old. I'm not going to tell you my age though. And I am a non-smoker. And they're going to spit out a price for me based on that. They are not looking at pre-existing conditions. So you don't have to worry about any condition or health status you might have had before. It's not relevant and they won't ask those details. Affordability. They wanted to make healthcare more affordable, so they did premium tax credits. And I'm going to talk in detail about how premium tax credits work because they're a really interesting part of the Marketplace. But just like when you're on an employer plan, I don't know if you're aware, but your employer probably pays a part of your premium. That's why when you go into COBRA, if you've left employer coverage ever in the past, COBRA is much more expensive because suddenly that employer subsidy disappears and you're paying a lot more for it. Well, premium tax credits are kind of the way that the government mirrors that experience of an employer subsidizing your healthcare, but they're doing it through tax credits via the IRS. And then let's talk about patient protections. Kids can stay on our plans until they're 26 years of old. So when they're in college and they're not ready to face healthcare and taxes and all of this adulting that they call it, they can stay on mom and dad's plan and we'll keep them covered until they're 26. Insurance companies can't limit how much they're going to cover. They can't say, okay, we'll cover up to $500,000. Nope. They have to cover an endless amount of costs, no matter how costly it is, as long as it's written in their plan that's a covered benefit for your health. Marketplace plans have to cover at least 10 essential benefits. These are very important, and everyone has been benefiting from these. Preventative services on the right-hand side, these 10 essential benefits are on the right, but emergency services. All plans must cover emergency services in or out of network. They have to cover it. If you get in an ambulance and you go to the hospital, they cannot deny you for an emergency. Pregnancy, mental health, prescription services, labs, and of course, preventative. We all love going and getting that annual wellness exam, hopefully not a colonoscopy, but you turn a certain age, you have to do it. So those are all covered under our 10 essential health benefits as well. So now that we know the basics, let's talk about how the marketplace differs. It varies. I told you every state is slightly different. Texas has 15 insurance carriers, and they offer bronze, silver, gold, and catastrophic coverage. There's a lot of people enrolled in Texas, and there's a lot of choices. You're going to log in and go, whoa, how do I choose? And it's like typing in something generic when you're shopping on Amazon, like shoes, and it's going to come back and say 7,800 results. But Alaska only has two insurance companies, and they only offer bronze, silver, or gold. So you might go on, and if you live in the state of Alaska, and go, okay, I'm choosing A or B. Which company do I like better? So you might be limited in your choices. Although enrollment will be much easier, a lot less insurance to sift through, you might feel more restricted. California and New York, you can see in the middle, they offer 12 carriers, but they also have bronze, silver, gold, and platinum plans plus catastrophic coverage. So they're offering more metal types. So there's a huge variance. And if you're thinking about retiring and moving, like maybe you have a vacation home. I've heard a lot of people say, oh, we're 3 months in Colorado and then 9 months of the year here. You might need a health plan that covers both states, or you might be looking and trying to decide which one provides me better coverage. PPO plans. For those of you who do not know, a PPO or preferred provider organization is a plan that covers out of network services, that allows you to go travel or see a specialist who doesn't take any insurance plans, and they'll cover or reimburse you some portion of that plan. I would say, unfortunately, half of the states don't offer PPO plans. And this is a big adjustment for anyone who's working with a nationwide company. Say you came from Microsoft, IBM, or Coca-Cola, the Coca-Cola or Disney Corporation. You have employees across the whole country, and every single state has coverage. So your plan, you could go anywhere and everywhere you wanted and find doctors in your network. Now that you're going into the marketplace plan, it may surprise you to know there's no coverage outside of your border. This is especially important for people in tri-state areas or who live near borders. If you live in New York, New Jersey, Pennsylvania, Connecticut, and you're right on the border of one of those places, you may find that you can have a New Jersey plan won't cover you half a mile away in New York. Same thing with Washington, D.C. You could have a plan that doesn't cover Virginia or won't cover Maryland, even though it's right there. So I really want to caution people to pay attention to this in retirement and to plan for it. It's okay to have new rules or restrictions as long as you're aware and you can adapt and find the financial footing that you need to cover the access that you need. So if you have multiple residents, if you travel, if you go across state lines, like I mentioned, you want to pay attention to the networks. PPO plans are the largest. They cover in and out of network services, and they never require a referral to see a specialist. HMO plans, on the polar opposite of that, is a small, very restricted network. They do require you to see your primary doctor and get a referral to go to a specialist. So you got to go to your doctor and say, hey, doc, I'm not feeling so well. I got a tummy ache. And your doc's going to say, I want you to take this piece of paper over to a gastroenterologist and see a referral for this doctor. And they do not cover out-of-network coverage. So they're very restrictive. EPO, kind of in the middle. It's like Goldilocks and the Three Bears. One plan is too hot, one plan is too cold, and EPO is like right in the middle. It's a fairly large network. Referrals are required, and they don't have out-of-network coverage, but it is a bigger network. And some EPOs are even starting to not require the referrals. They're even starting to waive that. So it's really on the fence how close to a PPO or an HMO it might be. Let's look at provider coverage for this client who came to us from Williamson County, Tennessee. And you can see one plan versus another. There's a Blue Choice, which is like a Blue Cross Blue Shield, an Aetna, and then a United Healthcare plan. And across in the same area, the same zip code, different plans covered different number of doctors. None of the pharmacies were covered, and some covered more medications or less. So it's really important to be able to identify not only the PPO or HMO, but also specifically your doctors and your care team to make sure that they're covered under the plan that you want. So now I'm going to talk about costs. Costs vary a lot. They already told you they're based on your zip code, your age, your smoking status, and your gender, but they also can be based on the metal level. Do you want a bronze plan or a platinum or gold plan? Different metal levels affect different costs, and I'll explain that in just a minute how those work. And then your deductibles and out of pockets can be substantially bigger than employer coverage, up to $18,000 for a family plan on the marketplace. And they're also going to vary across plans. So let me go to this next slide. The average premium in the United States is $605 a month. With that premium tax credit, which I promise I will explain, drops it down to $88 a month. It's not so bad. Utah, New Hampshire, and Maryland have the lowest premiums, so they average $472 a month. Alaska, Connecticut, Wyoming, and West Virginia are closer to the $846 a month average premium. So each state, you can vary widely depending on the market, depending on the cost, the income in that state. So here's an example of two plans, a Premier Blue Cross against an Ambetter. The client was eligible for a premium tax credit of $1,107, and that's in green. That made the Ambetter plan completely free. Free healthcare. How do you beat it? But the Primera Blue Cross plan, also still bronze, still same metal level, was $1,142, and that's after that tax credit was factored in. That means that plan is north of $2,000 a month. So huge difference from one company to the next. Let's also talk about age. The younger you are, the cheaper you will be. The older you get, the more your healthcare will cost you. So this is looking at a client who is 59, and then we changed his date of birth and said, what if he turns 64? It's a man in Miami, a non-smoking male, and we wanted to see how the plan level changed from bronze, silver, and gold based on 59 years or 64 years of age. So you can see how it will increase the older you get. And that's worthwhile putting into your financial plan and saying to your financial advisor, hey, I got lucky. I retired at 57 years old. Woo! But between 57 and 65, my insurance is going to go up slowly and slowly and slowly until I can enroll in Medicare. So you can kind of look at those expenses and plan that out. So those medal tiers, I want to talk about them. Everybody thinks gold medal is the winner because we all watch the Olympics, right? And if you went swimming in the Olympics, you want the gold medal, not the bronze medal. Bronze is nice, but you want to be at the top of the podium. There is absolutely no difference in coverage. A gold plan covers exactly the same thing as a bronze plan. Very important distinction. The difference is in the financial strategy of how it's set up. The more expensive the metal, the higher the monthly premium will be, but the sooner the insurance is going to help out. So a gold plan might be $1,000 a month, but then the deductible or out-of-pocket amount is only $500. So you're paying a lot up front. I'm going to call it a set it and forget it plan, pay in advance. And then when you go to the doctor, you have very little exposure or financial risk, not a lot of bills. Gold is great for someone who uses a lot of healthcare. If you know you're going in and out of appointments and you have multiple events or surgeries in a year, you're going to be spending the money. It's better to spread it out over each premium throughout 12 months and have less fluctuating bills and less financial exposure to worry about. But you could pay more in the long run than a bronze plan. A bronze plan is great for the young and healthy. I'm young, I'm healthy, I stay active. I know my mother-in-law plays pickleball. I've heard clients tell me I go to every national park in the summer and I hike all the national parks. So I don't want to pay a lot up front. I want a lower monthly premium. And then if I go to the doctor, I have a bigger deductible to pay at that time. So bigger fluctuating bills, you can put it on a credit card or use your savings account, but less each month to pay for. The coverage, identical. It's just a financial strategy of pay more upfront or pay less upfront. So let's look at that though. Let's look at the out-of-pocket maximums by plan, and they do vary. We've got an Aetna bronze, a Blue Cross bronze, another Aetna bronze, and then boom, a platinum plan with Select Health. You can see the premiums, which is the first number there, range from $290 all the way up to $1,380, and that's including this client's tax credit. But the out-of-pocket maximums range $15,000 on the first plan, $16,000 on the Blue Cross, $18,000 with Aetna, and then that platinum plan is only $6,400. So we're paying $1,300 upfront every month to buy a platinum plan. But when we go to the doctor, we have very limited financial exposure. Again, see that estimated financial example on the bottom? In the long run, when you calculate all of those premiums for 12 months, plus the out of pocket maximum, the most you could pay out of your pocket before your insurance starts covering 100%, it's $22,964. It is more expensive on that plan than the Aetna bronze in the very beginning, the first column. So you will pay less on a bronze, but you're going to have a lot more fluctuating bills, a lot more exposure. So if you're using substantial healthcare, significant healthcare, the platinum plan can be better, even though it's more expensive because it evens your costs out. Otherwise, the bronze almost always work out financially the cheapest plan. So let's talk about those advanced premium tax credits. You keep seeing these green numbers and going, wow, this guy got $500. That last client got $1,000. How do I get my tax credit? I'm going to tell you. So American Rescue Act increased the income level for premium tax credits. This was during COVID, and they increased it. They also extended it right through 2025. More people are eligible than before. Premiums are lower when you apply the tax credit, and it's based on your zip code, your household size, and your income. So why do I say this? Somebody who lives in the middle of New York City has expensive healthcare. Our doctors cost a fortune here. So do our hospitals. If you have one county doctor in the middle of rural Kansas, it's probably a lower expense or cost of living out there. So that's why zip code matters. Household size. I'm a single person. I'm making $100,000 a year. I'm living at large. I enjoy going out with my friends at night. I don't need as much of a tax credit as a household with 5 kids running around that only makes $100,000 a year. They got kids going to soccer and ballet practice and after school this and movies with friends. And that family of 5 is now feeling the $100,000 stretching very thin. So the size of your household matters. And then, of course, your income. It's on a sliding scale. The more money you make, the smaller your tax credit will be. The less money you make, the larger your tax credit will be. The Inflation Reduction Act, which was signed into law in 2022, extended those subsidies. So they extended it through 2025, December of next year, and it's going to keep 13 million Americans from losing their subsidy. So it's quite a substantial number of people who are on these subsidies. We don't know if the subsidies are going to continue beyond 2025. So this is a space to watch. They are saying the buzz on the street is that the new administration, whoever is elected in November and signed in February, is going to need to look at this and decide if they want to continue those extensions or they're going to make an adjustment. So it will be a space to watch for 2026. But next year, status remains the same and everyone can be happily enrolled in their plan just as they were this year. So let's talk about the averages. California, Massachusetts, New Jersey, New Mexico, and Vermont have state subsidies on top of the federal subsidies, so they're giving out even more. I love when they give out free money. West Virginia, Wyoming, and Alaska are the biggest subsidies you can see there. The smallest are New Hampshire, Minnesota, and New York, and they range from $360 to $1,000 a month. So and these are the averages. Some people might be more, some people might be less, but those are the average premium tax credit. We're looking at a family of 2. So let's say you and your spouse retire at the age of 60 and you live in Fairfax County with an income of $80,000. Your estimated financial help was $973 a month or $11,000 a year in tax credit. The average cost of a silver plan is $500 and change. That it would be about 8.5% of your income. And without financial help, the silver plan would cost you $1,500. So it's a significant support. Let's look at how plans vary when you factor this in. We have here 3 plans again, the bronze Aetna, a bronze choice with Atrium, which has an HSA account, which I love as well, and then a standard plan with WellCare. They're all bronzes, so they're all that same metal level, but the first plan, when the premium tax credit of $894 makes the plan free. Free healthcare. I love it. The middle one is only $31 a month. That's very affordable. This last one, same bronze plan, but it's $1,291 a month after the tax credit. How much would it have been? Well, I can tell you it's $2,185 before that tax credit got applied. So why? It's a PPO plan. It covers out-of-state coverage, out-of-network providers. I was talking about that network access, PPO versus HMO. Those PPO plans come with a hefty price. You're paying for that flexibility to be able to go to travel and to see doctors anywhere. Let's talk about removing somebody. So we have a family of 4 happily living their life. They have a $960 tax credit, and that makes this Horizon Blue Cross Blue Shield Omnia Silver plan 1,864. Now, 2 of their children are dropping coverage. They're going on to either their employer plan, or I think one of them was going off to college and had a college plan. And mom and dad are so excited. They're like, we're going to cut our plan in half. It's going to go from $1,800 to $900 a month. Sadly, it's not the case. When you drop children, I mentioned household size, a family of 5 with the 4 kids running around and all going to soccer and ballet, and how that $100,000 was stretched thinner than the single person with $100,000. Well, when you drop children from your healthcare, your premium tax credit decreased. So their tax credit went from $960 to $262. And that means the plan is cheaper. It's still cheaper to drop 2 people, but the decrease in tax credit means they're only saving like $100 and 30 something change. So they were very disappointed not to see their plan cut in half. So adding or removing your children is a big factor. And we do a lot of hypotheticals where parents will say, well, what if I could take my child off? What if I put my child back on? What happens if I do this or that? We love those hypothetical planning conversations. We welcome that kind of questioning to help us find the most optimized situation for the whole family, including everybody's unique needs. So, how are you eligible for tax credit? You're enrolled in a marketplace plan. You're a U.S. citizen or a legal resident. You file your income taxes. That's important. The IRS likes it when you file your taxes. You are not qualified for Medicaid or Medicare. So, if you have a income that's substantially low enough to qualify for Medicaid, you no longer are on the marketplace. You're now switching into Medicaid coverage. And then also, you can't be eligible for an employee plan, either yours or your spouse's, that offer minimum essential coverage. How do you claim your tax credit? One, when you're applying on the marketplace, you're in Amazon and you're shopping for your health plan, you add it to the cart and you're checking out, you can estimate your income. Tell them how much you make, and they're going to estimate your tax credit and apply it to your plan each and every month. So it reduces the cost that you pay for your plan. If you over or underestimate your income, when you file your tax credits, it's reconciled when you file taxes. So for example, if I think I'm going to make 100,000 and I end up making 150, the government is going to say, "Oh, Clarice, you took too much tax credit. You owe us money back when you file your taxes." But the opposite is true. If I didn't quite come in at 100,000, I only came at 90 or 80,000, maybe I had shift work or I had an unemployment month in there, the government's going to say, "Hey, you didn't take enough tax credits. You said 100,000, but you only ended up making 90. We owe you money in your tax return." If you don't want to have an IRS fluctuation or debt, you can update your income mid-year. You can say, "Hey, I got a pay raise. I was on a $100,000 salary. Now I'm making 150," and they'll adjust it for you. Or option 2, you can opt to pay full price for your marketplace plan. You can say, "Thank you for my $500 tax credit, but I'm going to waive that, pay the full price of the plan, and then when I file my taxes in the spring, I can claim that back in one lump sum." $500 times 12 months, that's a pretty nice tax return. So there's multiple ways you can claim it. Let's talk about how you pick optimal coverage, and we'll be winding down here. Preferences are everything. First of all, you want to look at your healthcare needs. Are my doctors covered? Are my medications covered? What access do I have to care? But then I want to talk about my preferences. Maybe you want to make sure I want all my doctors covered. I love my OBGYN. I've been going to her for 20 years. I don't want to change. Maybe you want a recognizable insurance company. Say, "Hey, I want a household name brand company that I recognize and trust. A big company like Blue Cross Blue Shield, United, Cigna, Humana, something that I never know. I don't want to go with some insurance company that just started last year. I don't trust them." You might want a low monthly cost. Say, "Hey, I am very low on income in my retirement. I want that $0 or low cost bronze plan. I don't want to pay for healthcare I don't need or I'm not using." You might want the lowest financial risk. You might say, "Hey, I use a lot of healthcare. I'm a high utilizer. I go in and out. I know I have a health condition. I want to pay for that gold or platinum plan. Even though it's more expensive, I don't want a lot of financial bills or exposure. I just want to set it and forget it." You might want a plan that's well rated. Nobody wants a 1 star out of 5 star health insurance plan or 2 stars, right? We all want one that's 4 or 5 star rated plan. And then I might like to keep my same insurance company. Maybe my employer plan was with, I don't know, Humana. And I've been with Humana for ages and they're really nice and I love their customer service. I just want to stick with what I know. So let's see how your preferences affect the plan optimization. Here are 4 plans that we knew already covered this client's doctors and what they needed. We have an Aetna, which is a recognizable carrier. They wanted an HSA plan because they're saving for their future. And I'm going to talk about HSAs for you guys. Then we also have a PPO option. Maybe they travel a lot and they really wanted to have that national coverage. There's that $0 monthly premium. Oh, that's so tempting, that low cost healthcare. But actually, what I'm worried about is the lowest financial risk. I don't want a lot of exposure to risk. I'm willing to pay $31 a month to reduce my overall financial costs, which is this middle plan at $7,628. So your preferences can really guide you to the plan that's right for you. Let's talk about coverage. The first plan, yes, it was affordable. It was that $0. We liked that $0 premium. It was so tempting, but they didn't cover the pharmacy. I'd have to switch from CVS to Walgreens, and Walgreens is like 4 miles away, and CVS is right next to my work. So you might go with the middle plan because it was the lowest overall financial exposure, but it also covered everything you needed. Maybe you're more worried about your primary care doctor. I go 2 or 3 visits a year. I just want to pay a flat $15 and not think about it. Or maybe you're like, I don't even see my doctor. I just have a generic prescription that auto renews every year. It's like a maintenance drug. I don't even have to go to the doctor. I just call and say, hey, renew my prescription. So I'd rather that third plan, which is a flat $20 to pick up my prescriptions. So there's a lot of different choices you can look at when picking a plan. Now, HSAs. I do love the opportunity of a good HSA. HSA accounts is a health savings account, is an opportunity for you to put money aside and save for healthcare expenses. You can put in pre-tax contributions, which is fantastic. So it's a tax shelter as well. 4,150 for individuals. Families can do 8,300. That's this year's contributions. I don't have 2025 yet, but I'm excited to get those numbers. And of course, if you're over 55, just like your 401k retirement plan, you can do an additional contribution. They call it a catch-up contribution of $1,000. So this is going to shift the cost from the insurance company to the beneficiary and allow you to optimize your healthcare. And it's really good for healthier individuals. So I will tell you, the money you put in the HSA can be pre-tax. The money you gain if you have interest or if it's earning money in the account, it's tax-free. And if you withdraw the money to spend on healthcare expenses, it's also tax-free. So they call them triple tax accounts. Preventative services on high deductible plans with a HSA account often are bigger lists than your traditional plan. So, for example, congestive heart failure or coronary artery disease, hypertension, diabetes, asthma, liver disease, and depression. These are all things that you can have regular preventative medicine for. Your normal insurance wouldn't consider that preventative. But for the count of a high deductible plan, you can have those be preventative care because you're preventing bigger healthcare incidences by staying on top of your maintenance and your health and making sure you're doing the right steps. So they encourage that by making these preventative services that are covered 100% with no cost to you. Here are some, not all, some of the qualified medical expenses you can spend your HSA money on, like blood sugar testing and kits for diabetes, drug prescriptions, hearing aids, long-term care, medical equipment, and I've highlighted a few like wheelchairs, vision correction, including like LASIK surgery. A lot of people like to ask about. And again, these are just some of them, but you can withdraw your HSA to pay for these type of services. Feminine hygiene products. So even if it's not covered by your health plan, you're going to the pharmacy and you're picking up vitamins or your feminine hygiene product, you can use your HSA account to pay for that. And it's still qualified and doesn't charge you taxes. HSA accounts roll over year after year. So if you put in the family contribution of 8,300 and then the next year you put in 8,300 and the next year, I saw someone retiring at the age of 60, I think it was, or 61, and he had like 75 grand in his HSA. And he was like, all of my healthcare when I'm older and when I have a lot of expenses can now be covered by this account. So if you have the financial means and you're looking for a way to keep your money from the tax man, if you're trying to think like, how else can I can open a Roth account, I can do this, I can do that. How else can I keep my money from the tax man? HSA is a wonderful opportunity for you to consider. So let's talk next steps, and we're going to wind this down here. Health planning analysis can help, and you can ask your financial advisor over at Retirement Planning Services if this would be of interesting to you. You saw some of the examples throughout the analysis where I had these side-by-side plans. This financial analysis will show you a financial comparison, so side by side, who's the cheapest health plan, but it'll also be tailored to your budget, whether you want bronze or gold plans, how much healthcare you use, are your doctors covered, is your pharmacy and medications covered? What are your preferences? Do you want a big brand name company, or do you want a 5-star plan, or do you want the lowest cost? So we look at your network referrals, whether you travel, if you're interested in an HSA account or you don't want an HSA account. All of these factor into optimizing your healthcare specific to you in your state, in your zip code for your options. And we already know the marketplace varies one state to the next. So it's a guide to help guide you in the right direction. Open enrollment this year, if you're on a marketplace plan, or say you're on Cobra or a retiree plan and you want to switch to the marketplace, it's November 1st through January 15th in most states. Some of the states that have their own platforms have carved the dates out slightly differently. So it might be like October 31st through January 13th. So it might be slightly different, but this is the right approximate time frame. If you remember November, in November, you can change your health plan at any time. During open enrollment every year, plans change. So the premiums might go up, the monthly cost, your out-of-pocket maximum or deductible or what you're exposed to. The provider network, maybe your beloved OBGYN is leaving Cigna and they're going over with United now. Drug formularies, the list of prescriptions that are covered can change, and your preferred pharmacies. And then, not to mention, our needs change. Maybe last year we weren't moving or we didn't have a certain prescription, and now this year we do. So there's a lot of reasons to keep looking at your health plans every open enrollment and making sure you're not overspending by 38% like the people who let it auto renew. So federal open enrollment, I told you, January 1st through the 15th. Here are the states at the bottom, the initials, Arkansas, California, Colorado, Connecticut, etc., that have their own platform and may have their own dates. I do want to call out, even though open enrollment goes to January 15th, please enroll by December 15th if you want the coverage to be effective January 1st. If you enroll from December 15th to January 15th, it won't start till February. So enroll by December 15th, November 1st through December 15th. How would you enroll in the marketplace? Well, you go to either healthcare.gov if you're a federal state or your individual state marketplace, and you create a username and platform. Then you browse, just like shopping on Amazon. When you're ready, you send it to the cart and you proceed to checkout. They will ask you to pay your first month's premium. And then 2 weeks later, you're going to get your ID card in the mail, and you can set it up forward dating it. So I could go on now and say, I want coverage to start October 1st. And they would take my month's premium, but then the card would arrive in the mail and it would all be in place, ready to go to turn on effective October 1st. If you miss open enrollment, or maybe you have a special enrollment period, so say you lose your employer coverage, you move house, you were in one state and now you're living in a completely different state. If you change in eligibility, if your household changes, so there might be things like we got a divorce or widowed, heaven forbid. Maybe you got married, which is great news. You want to add your new spouse to your healthcare plan. Any of these life events are special enrollment triggers, and they open a new window, which is 60 days before the life event and 60 days after. So if you know you're going to retire, 60 days before you retire, you can start the process. If you were like, surprise, I didn't know I was moving, but then it all fell into place so quickly and now I'm suddenly in my retirement home, 3 states away, closer to my grandkids, then you can enroll up to 60 days after. Qualifying life events. Turning 65 is when you'll want to leave the marketplace and go to Medicare, but you might have a child, I said was 26 and going off onto their own or going to college. You might have a retirement, a job loss, COBRA expiring, or your retiree benefits changing. Again, you might move or have a change in your marital status or income. So all of these life events will qualify you to make a new enrollment. And with that, I hope this has been helpful. I'll pause if there's any questions, but it was delightful getting a chance to share some of this with you today.
This is great, Clarice. And one of the things that we're excited about as well is we can actually do modeling to figure out how much income would be optimal to have coming out of retirement accounts or other arenas, so that we can make sure that we understand also the subsidy that's involved. So there are times where we really need to focus on which account we're taking distributions from, so that we can know what the subsidy is going to look like and how much the medical insurance is going to be, the healthcare insurance is going to be. So really thankful for Caribou's help in that, because we can look through that in real time and make sure that we're giving good guidance and looking at the entire picture there. And that's a nuanced piece.
Yeah, absolutely. I mean, I can't tell you how many clients have asked for a range and said, what if my income was this amount? And then going up incrementally by $10,000 or $20,000 until I reach a maximum of, and we will show the premium tax credits and say, okay, let's set your income where it benefits you, the maximum amount that you can be benefited and get the best coverage for your needs. 100%. I love that strategy.
And it's so interesting because we have so many clients now that have access to Roth accounts. So if they're 61 and they can take a Roth distribution rather than a traditional IRA or another type of distribution that might be taxable. Sometimes even if it's a marginal tax bracket that's fairly low with that subsidy involved, now we've got a bunch of different considerations. So that complexity that y'all help us to solve is huge. So grateful for that. Well, again, we appreciate you coming on and being able to share all these details with us and the information. It will be a huge benefit to clients going forward. So thanks again, Clarice.
Yeah, my absolute pleasure. I love it. And I welcome the conversation. So, bring on the questions as clients come and have these unique situations. I think if anything came across my presentation, it's every state, every zip code, every client is completely different. And so we want it to be highly customized.
If you like these financial planning videos, please share with a friend, and if you have questions, go to our website at SiriusRetirement.com. This content was provided by Retirement Planning Services. We are located in Knoxville, Tennessee. You can visit our website at SiriusRetirement.com. The information in this recording is intended for general educational and informational purposes only, and should not be construed as investment advisory, financial planning, legal, tax, or other professional advice based on your specific situation. Please consult with your professional advisor before taking any action based on its contents. Advisory services offered through Retirement Planning Services, LLC.